Right, welcome. Dr. Miaken Ziegler of Monarch Family Chiropractic. Welcome to our Tuesday night spinal workshop. We're talking about spinal hygiene and talking about backpack tips. But I love Tuesday nights. They are times for us to reconnect to the things that matter. And I say that because if you were joining us in the office, live on Zoom, or listening to it recorded, whenever we hear a workshop, we always come back to the why I do what I do, right? Why are you choosing to get consistent chiropractic care? Why are you taking care of your spine? Is it because you want to be on a different track in terms of your health and longevity? You want the next 30 years to look better and thriving? Is it that you want to play with your kids? Is that you want to be healthy for a pregnancy? Is it that you want to model healthy behavior for your family? Whatever it may be, these Tuesday night workshops help hold you accountable to things that are honorable and principled to health and vitality, to connection. So we get super excited about Tuesday night workshops. As we get into it, we get more excited. So I'm honored and grateful that you're here with me tonight, because I know that if there's one thing you pick up from this, it will help support you making more informed, most right decisions for your health. So I want to share with you a recent patient that came in, new patient. And as I was taking her history, her main complaint was, well, she had mid-back pain between the shoulder blades. Well, and then she had neck pain. And then she shared with me, well, I also have low back pain. And it's been going on for 4 years. And when it's at its worst, it's 7 out of 10, best 3 out of 10. And on average, it's about 4 or 5. So she experiences this back pain all of the time. And it's worse when she's sitting, sleeping posture the wrong way. If she doesn't sleep the right way, it can really flare things up. And it is tight and it radiates into the low back, but it's also the mid back. It's also the neck. It is just always there. So my question for you is, how old do you think this patient is? Somebody who's experiencing chronic pain, because anything that's longer than 3 months is chronic. 4 years, on average, 4 to 5 out of 10 pain, and it's through her entire spine. The guess in here is 27. Okay, Brandon was gonna say 29.
Nothing.
Yeah, if you knew nothing, right, you would think this is a person who is maybe a little bit older. Ashley said 7 years old. Guess what? You're closest, Ashley. She's 11 years old.
Hey.
So this kiddo started experiencing pain when she was 7 years old, and it's continued for the last 4 years, and now she's 11. Okay. So that's why we're talking about backpacks in the house tonight, because kids experience pain, and oftentimes they don't necessarily have the verbiage, they don't have the language or the ability to express exactly what they're feeling. Now, this 11-year-old, of course, did, but sometimes we tend to maybe minimize what our kids might tell us in terms of what their bodies are saying and what they're feeling. And so this is just a check to say, you know what, if a kiddo is bringing something up about their body, it's important to them, it's important to us, and let's take it with some curiosity here. So our agenda tonight is first understanding that there is appropriate and inappropriate use when it comes to wearing a backpack. And when it comes to a backpack, this might be a no-brainer, but there is a proper size for your body. And we can give you some good ergonomic tips and talk about how to support your frame and structure. So first, incorrect use of a proper backpack can be just as damaging as using an improper backpack. Let me read that again. Incorrect use of a proper backpack can be just as damaging as using an improper backpack. So even if you're spending the cash to get a real nice backpack, if it's not utilized properly, it's going to hurt you, just like the backpack that costs, you know, that's maybe on, you know, the more budget friendly side, doesn't have all the gadgets to support you. So we care about how it fits.
What about the opposite? Improper backpack, could it somehow be good for you if you wore it in a weird way?
Yeah, so the question is, well, what about if you have a not a great backpack, but you wore it more correctly, would it be better for you? And I would say you can maximize in the best way possible your bags that you're using, but sometimes there are just not great bags or not great backpacks. So let's just get, you know, the bird with two stones, or whatever that saying is, and make sure it's proper and worn properly. So we look at structure and posture all the time, right? If you have distorted posture, that means there's distortion and stress into a spine. Now you're talking about if you've got distorted structure, and you add in something that's going to accentuate that, add more stress to that and pressure and weight, what can that lead to, right? Chronic stress and chronic back and potentially shoulder pain, right? So smart choices now are important for lifelong years during and post-school ages, okay? And this is just one component of supporting the health and well-being of your child, right? There are sometimes layers and layers and layers of stress that we all experience, right? We want to get to school okay. We want to be caring and making sure all the things make it to class, but then we're also sitting for extended periods of time, right? So, I mean, we can take and look at our day-to-day experiences and see, oh, there are opportunities for stress in every moment of every day. But if you can minimize that stress, it minimizes the stress your body incurs over time. So, inappropriate or worn incorrectly. So here's signs to assess. If somebody has headaches at the base of their skull, okay, if they have neck pain or pain between their shoulder blades, if they had marks on their shoulders, or if their shoulders are leaned or rolled forward, okay, if their stomach is stuck out while carrying, okay, so if we see this, and you guys can't see me here, right, if their stomach's really forward. If they're bending forward at the waist to support the weight, or if there's any ever numbness in the arms or hands, that is a red flag right there. But if, I mean, you can do a quick history with your kiddos. Do you ever experience any of this? Let's put your backpack on, let's take a look. All of these are indicators that there is inappropriate use of the backpack, okay? So when they have them, well, first of all, I say they don't necessarily have to have their backpacks on to experience this, but if they put the backpack on, you see any of these indicators, those are not a great backpack fit or an improper bag. And by the time you're getting pain, by the time you're having numbness, if you're having marks on your shoulders, I mean, that's an indicator that that is more of a chronic situation, that this has been a problem for longer. Okay. So let's talk about what to look for when you're purchasing a backpack. So first you want a lightweight bag that is the same length as a child's torso. It sits no higher than the top of the shoulders, okay? No lower than the top of the hip bone. So as we're watching, let me get my scroller here. You know, I like to draw. So again, this length here should match their torso length, okay? And it should not sit higher than the shoulders. So you can see how this is right at the top of the shoulders, and it's no lower than the hip bone, okay? The hip bone is actually right here. So this is, here's the femoral head right here. I'll try and make an X. Right there. Okay, so it sits no lower than the hip bone. And that's, well, excuse me, I'm saying that this is the hip bone, but we're talking about actually the top of the pelvis. So no, I mean, let's use that big, bulky pelvic mass right there. That's what they're talking about, the hip bone, okay? it should have the strap should be 2 inches wide, okay? At least 2 inches wide. And the chest and weight straps are helpful to balance their posture and their weight. So a lot of times there'll be a strap for the chest, the strap for the waist. A lot of times if it is coming around the waist, that helps anchor and helps absorb the weight of the backpack. You can add for padded for comfort, and it has compartments that evenly distribute the weight. So you can think about, I mean, I think about my backpack that I had growing up, right? There was like literally two pockets, the big one and the little one, right? And I don't know what kids are like at school these days, but like having the strap around one shoulder, right? Or letting it sag all the way back. I mean, it was just like, I just don't even think ergonomics when it came to wearing it or using a backpack was even in anyone's brains, you know? And when you're adding in all of this weight of books and notebooks and multiple classes that have different types of books, we've got to make sure that we are supporting our kiddos here, right? So these are great, I would say, items to take to the store with you if you're going backpack shopping, or first to check off the list of, okay, what is the kiddo wearing right now? Okay. So some tips: place heavy items closest to the back, okay? Closest to their center of gravity. Now place odd-shaped items outside to prevent poking. That's nice. You don't want to be poked, right? Especially if you have heavy stuff in your backpack. You want to constantly be poked and having that rammed into your back. Place backpack on from a table height or lift properly with the knees. Okay, so if you think about it, I mean, I can remember a lot of times picking up and kind of like you'd pick it up and you swing it around, right? You create some torque in your body, or you're lifting from one side or the other. Again, that may not be a big deal for a kiddo who has, you know, healthy motion, movement, structure. But if there is a kiddo who is dealing with chronic pain, like our 11-year-old over here, that's going to cause significantly more stress. So how can we start supporting and, you know, ourselves by lifting properly? So it would be, you know, place backpack here and then put in from there, right? Carry extra book or lunches in hand. So don't pack that thing full. And have child's pack be assessed by your chiropractor. So we are happy to, you're like, I just don't feel like I am totally competent to check the backpack. Then bring them in here and we're happy to check them for you. You know, I don't think I need to say anything more there. So elementary students should not exceed 10% of their body weight. That's interesting. So if, I mean, I could imagine that an elementary student would be what, second to sixth grade? I don't know, elementary, second to fourth grade, that elementary, first to fourth grade, right? So, I guess I only have a 3-year-old who's 30 pounds. But I can imagine that, you know, we're talking 45 to 85 pounds, you know, maybe on the bigger side, 100. So if you take 10% of that, you're talking about 4.5 pounds to 10 pounds. That's not a lot, right? Junior and senior high students should not exceed body weight of 15%. So it's not like it jumps a whole lot as you are starting to mature in your musculoskeletal system. That's where the waist straps, I think, are really wonderful because it helps distribute the weight of the bag. It takes it off the upper body and puts it at the keystone, which is your pelvis. And of course, talking to chiropractors here, so we're looking at how is that structure and spine moving? What's the balance and health of the body? So anytime you're adding weight to a structure, you want to make sure that structure is healthy. You want to make sure that structure can handle that motion movement. And so, you know, we certainly encourage and recommend that every kiddo get checked, no matter their age. Because I think, this patient that I shared with you at the start is not unique. I think more of our kids are experiencing pain than not. And, I think we're getting less and less physical activity. We're getting more screen time. I mean, there's just it's a different childhood, a different type of schooling than it was for, all of us who are, older than 30. So I think that taking care of your spine is massively important, no matter your age. But the best time to do that is now. So, so I didn't put a slide in here, but I do think it's worthwhile talking about ways to carry. Women tend to carry a purse, right? And what's nice is fanny packs are kind of back in, aren't they?
Oh, yeah.
Yeah. We kids of the 80s and the early 90s never thought those would come back, but they are back.
But it's like, how do you wear them? Because now they get worn like over the front.
Right.
And like,
Right. So, I mean, here's the thing. I would say just like the recommendation in terms of backpack straps should be at least 2 inches wide. The women who are wearing or using bags that are just a little leather rope or, a rope that are just thin and they just dig in, even if you're putting it across the body to kind of allocate some of that weight once, not carrying it one side or the other, that is still going to dig in. That's going to be stressful. So I would look for a bag, you want to make sure you have a wider strap that can help, distribute that weight that your body's. Oh, look at you.
This is
Look
my
at
purse.
Kathy. Kathy has a nice little purse that she wraps around her wrist and carries. So her back is taken care of here. So, I mean, I would always look for wider straps. And again, I do like cross-body bags as opposed to one-sided. Is there a crossbody bag that really fits against your body? And I would consider, like, how heavy is the bag? Just like the backpack, you shouldn't exceed 10% of a body weight for elementary school or, junior high, 15%. These are backpacks that are, formed to your back. I would say a purse should certainly be less than that. So if you are a mom carrying, a toolbox in there and all the things that you need, you may need to consider a different type of bag because that shouldn't really go in a purse. But I tend to find that women like one shoulder over the other. They're always carrying one side over the other. Again, that causes stress, that pulls you down. That causes asymmetry in the body. The body is meant to be symmetrical. So I would say, look at that strap, look at how heavy that bag is. Where are you carrying that bag? Are you carrying it? Is it something that's going with you? And are you doing a lot of traveling during your days? Are you in and out? Or are you kind of going to one place, parking, you're there all day and you're out? Maybe you can get away with a heavier purse that you can carry. But if it's something that you're carrying around, I like the cross body. I actually don't mind that those fanny packs go across the body. But again, I want to make sure that it fits to the body and it's close to the body. It's not hanging. I do like a fanny pack that fits around the waist, so that's nice that so it's nice that those are back. It's nice that those are back in style because it really is a nice way to carry your things and support your body. Did you just call me a dork?
oh,
I got my
that
purse
was
down.
Doc. It sounds the same, but it's not quite. I said Doc.
So, I mean, I guess I would just start there. If you have a bag, how does it fit to your body? How wide is the strap? And where are you carrying it? A lot of times the bags that are more ergonomic and fit your body, sometimes they're made of more fabrics, canvas, versus the leather. Again, I'm not against leather. It's just, what does the strap look like and how's it fitting against your body? And how much weight is it holding? I don't even think we even consider or think about that. We're just like, oh, fit more stuff in there. Let's get more stuff in there. Now,
Oh,
go ahead.
that's like men's wallets.
That's exactly where I was going
Oh,
next,
word.
Kathy.
Okay.
Because, I mean, sometimes men don't carry around a bag, but they got a wallet. Some men have like a nice old Costanza wallet. Yeah, so
That's kind of bulging there.
here's one. Now, where were you, where was this? Which pocket was this in?
In my back right pocket.
Yeah.
It
no.
takes up like that much space in it.
Yeah,
It's not necessarily good to sit on.
no,
So I
it's
kinda
not good.
I slide
You
it to
carry
like,
yours to the
I
front.
slide it over here, kind of when I sit down.
So this is what I'm gonna tell you, men who have and use wallets, you want to fit that thing in your front pocket. You should never be sitting on that. Should never be sitting on your wallet. Like, and if you are, take it out and put it in your front pocket. And if it doesn't fit in your front pocket, get a new wallet and go through it and get rid of stuff,
That's probably what I should do.
you know?
Get rid of stuff.
I mean, I just bought my husband a really nice like leather that fits nicely in his pocket. It won't get any thicker because and I'm just like, you don't need a wallet that you're sitting on that literally, rocks your pelvis this way and then you're there for hours. You're hurting yourself. You're causing problems.
But it can fit so many cards.
I'll take some of your cards.
So, maybe your card index needs to come back into the mix here. But that's what I would say for men. I mean,
Yeah.
if you're carrying around a wallet, it does not go in the back pocket. I mean, sure, as soon as you sit down, you take it out. Okay, get a fanny pack. House that thing somewhere else. So any other questions? Yeah.
So, we have like abnormal size backpacks, but like with normal size straps.
Like you have a really big backpack and it's got,
We have a really small backpack.
oh,
But with like, I think they have kind of regular size straps and they can be adjusted.
yeah.
So are those the same principle? Like, they're not gonna be as long as my torso, but like,
Yeah.
do I just wear it super close to me? And
Yeah.
that's the best way to do
I
that?
think that would be, and usually they have less pockets, right? If it's a smaller backpack,
It does have,
there's-
it's,
that has, yes, it has pockets, but maybe less pockets.
Yeah.
Because I have some of those too. So yes, I would still make sure that it's hugging to your body and fitting to your body. You don't want a lot of gapping. You don't want it hanging. And it may not go all the way up to the top, may not go all the way down to the bottom, but it's still going to be, close to your body. And you're going to be thinking about what are you putting in there and how much are you putting in there and how are you packing those things?
well, there's only so much that can fit inside of that simple thing. too.
Yeah.
So it kind of limits you.
And where I think that there's just a reality that in some situations you have multiple bags, like moms, new moms. You think about new moms who've got the diaper bag, the purse, the car seat, the baby, right? So, and they're all heavy. And so that's where, again, you want to make sure the diaper bag is going to go with you for years, wherever you go, for probably the first 2-3+ years of their life. So you want to make sure you get a good diaper bag with you because that can also, be your purse. So it's like, how can you minimize, the bags that you have so you can get around without feeling like you're totally stressing your body. So I would say, again, it goes back to make sure you have a high quality bag based on what you need, whether it's for school or it's a purse for getting around, or it's, for a specific situation where you just need to carry more stuff. Like an example is a young mom. So, so this is my hope that this has given you some, ideas on where you can start to really assess how you're carrying things around, especially if a backpack is or a bag is a main mode of carrying your personal stuff. And if you're like, well, it might be interesting, Kathy, because that's a hand, you're holding that by hand, but how heavy is that, right? But you can set that down a lot. wherever you're going. So maybe you're starting with the fit, maybe you're starting with the weight, maybe you're starting with how you're packing things. But when you start to follow through with some of these recommendations, you are saying yes to a healthier body, whether you think about it or not.
Yeah.
Because everything you can do to support a healthier body without having to think about it, the better off you are. We want to minimize the cumulative stresses that your body takes on over time. Just like if you're working at the best ergonomic setup that you can have at a workstation, you don't have to think about it. You know, it's working for you, right? Orthotics, they're working for you. You don't need to think about it. So make sure your bag works for you and fits for you. So whenever you're packing it and wearing it, it's working for you, not against you. Does that make sense?
Mm-hmm.
So here's how I will end this. My challenge is that if you know of a family who has school-age children, I would encourage you to ask them to get checked. The more kiddos, I mean, we are in, our health is in dire straits, really. I mean, we are a generation where our children their life expectancy is less than their parents. That's scary. Our kids need help. They need support. They need a lot of love because they don't always know the level of stress that are in their lives. And we have to look out for them. And so I know that if they have a free and clear brain and nervous system and they are functioning and firing on all cylinders, they're going to be more connected to their body and better processing and make better decisions, right, about their health. They're going to feel good about who they are. And when you're feeling in pain, you don't want to move anywhere, you don't want to go anywhere, you want to do anything. That's not what childhood is meant to be like. That's not what life is meant to be like, but certainly imagine childhood. It's meant to explore and to learn and to connect, right? And that's what we want for all of our community here. So if you know of anybody who has kids, who you hear kids complain, say, hey, my chiropractors, they'll check you for free. You don't need to go see them, but they'll at least support, you know, the best health of your kiddo or give you some good recommendations. So we love and appreciate you. Thanks for being with us tonight. And I look forward to hearing your takeaways when you're in. But Dr. Miaken Ziegler, Monarch Family Chiropractic, and we'll see you next time.
Thanks, Dr.
Thanks, Salma, for being here.
Thank you.
Okay.
Recording.
Did I stop the recording?